I'm Dr. Michael Cheesem with the First Committee of the Society of Cardiac CT, and I'm here with Dr. Todd Villines, Director of Research in Cardiac CT at Walter Reed National Military Medical Center, and Program Committee member for the upcoming SCCT 2013 meeting. Thanks for joining us today.
Thanks for having me, Mike.
Dr. Villines, with significant growth in the field of cardiac CT and research, how do you stay on that cutting edge, and how does SCCT help you get there?
Well, first of all, I think go to the meeting. This year's SCCT meeting is packed full of the latest and greatest, whether it be the latest clinical trial data, the latest, soon-to-be published work, TAVR, use of CT in various new indications, new hardware, new software, new technology. So going to the meeting first and foremost. I think it's the only meeting in the world dedicated exclusively to cardiovascular CT. So I would definitely do that. I think being a member of the SCCT gives you access to an excellent journal, the Journal of Cardiovascular CT, the website, a wealth of resources that keep you abreast, whether it be course offerings or email or various different online sources that the SCCT promotes. So I think becoming a member of the SCCT, going to the meeting, participating in the society is the first biggest step to staying current in cardiovascular CT.
Yeah, and with a record number of abstracts at this year's meeting, are there any particular topics you're interested in?
Well, this year is going to be exciting because, for the first time ever, we have a session devoted directly to fellows and residents. As you mentioned, there's a record number of abstracts. There's a multimodality imaging session, which is exciting to learn how CT fits in with other cardiovascular imaging technologies. As well as, back by popular demand from last year, is a session devoted to the use of coronary CT angiography in emergency department patients, which, as we know, has some very compelling data showing that we can become more efficient, effective, and cost-effective in evaluating patients with chest pain who present to the emergency department.
So for current trainees thinking about getting involved in the society, what does it mean to you to be a fellow member?
Well, as a fellow in the Society of Cardiovascular CT, it's really changed my career dramatically. Through the SCCT, meeting experts in the field, networking, it has, from an academic perspective, exposed me to a wide array of opportunities, which, quite frankly, I would have never had unless I were a member of the SCCT and went to the meetings. And so for me, it's been tremendous value. I think by becoming a fellow in the Society of Cardiovascular CT, it really demonstrates a commitment to taking that next step to achieving, I think, a mark of excellence, a mark of devoting oneself professionally to not just doing cardiovascular CT, but becoming an expert to teach others and to pass on that knowledge. And I think that's what the SCCT demonstrates.
It's particularly apropos that we're going to Montreal and thinking about the international community of cardiac CT in collaboration. I know you're a big part of the CONFIRM registry. How has the CONFIRM registry helped shape our guidelines, and what have we learned from CONFIRM?
Well, I mean, kudos to Jim Min for having the vision to put together this large, multinational, dynamic, prospective registry. We were very fortunate to be invited to be a part of that, and I think it's taught us so much about not just the prognostic value of cardiac CT, but as a number of different the breadth of the registry is really tremendous. So it's allowed us to look at subgroups that before we really hadn't been able to, such as diabetics, patients of different ethnicities. But it's also shown us that CT is a very good gatekeeper to the cath lab. It's created some very interesting hypothesis-generating work, such as looking at the potential impact of revascularization at reducing outcomes potentially based on a subset of patients with very severe disease on CT. So these numerous seminal studies have come out of the CONFIRM registry. They continue to come out almost monthly. I think it's really shown us that while we await large international prospective trials, that we can learn a lot from the patients that have been scanned already. And I think, again, kudos to Jim Min and all of his colleagues for trying to maximize the data that we have currently available to us, and by doing that through a collaboration of international imagers.
And certainly in the United States, at least with the current climate of reducing costs and looking at resource utilization, what niche or what potential does cardiac CT have to hopefully improve our healthcare?
Well, I think that the data from the emergency department is compelling, and it's shown that coronary CT, when done in appropriately selected patients, can reduce wait times in the emergency room. It can reduce admission rates. It can reduce potential costs of care. And I think that we know this now from very well done prospective multi-center trials with level 1 quality evidence. And so I think that's probably the first step. And I think what we're seeing now with not just the Society of Cardiovascular CT, but other societies is working together and implementing this now throughout not only the United States but internationally, so that patients don't have to wait as long to get an answer, and then we can perhaps even more efficiently and effectively assess and triage patients who present with acute chest pain. So I think that's just one example of how the literature is evolving. I think many of us who evaluate patients with chronic or stable chest pain also believe that's a very effective way to efficiently exclude severe coronary disease in a large number of patients consistent with current appropriate use criteria. And so I think we're waiting long-term prospective outcomes trials for that subset of patients. But I think many of us who do a lot of cardiac CT feel very confident that it has not only a current role, but its role will likely expand in the future, particularly as radiation and technology has gotten so much better and made this a very, very safe and even safer, more accurate test over time.
When you're not at the meeting, is there anything in particular about Montreal you're excited about? Have you been there before?
I've only been there once. I'm excited. It's just a fabulous city. The last time I was there, I had fabulous food, and so I don't think you can get a bad meal in Montreal. So when we're not busy talking CT, hopefully, I know I'm looking forward to seeing the historic side in the old city of Montreal and having a few good dinners. So.
I'm Dr. Michael Cheesem with the First Committee, and I'd like to thank Dr. Todd Villines for joining us here today. We're all excited for the upcoming meeting, and we hope to see you in Montreal. For this and other videos, please join us at youtube.com/firstinimaging. Thanks, Dr. Villines.
Thanks, Dr. Cheesman. Thanks to all the First Committee members. I think this is fabulous.